Hello friends, and welcome to another quick tips video. Today we're going to talk about medication reconciliation. We're going to go right over here to our Reconcile Meds tab in our patient chart. There's a lot of information here that's helpful for you. You can see that the last time this medication list was updated was a few minutes ago, and you could see the person that did it. So this tells you how old this medication list is. So let's just say you want to see what they were on before they came into the hospital, maybe the last visit. So a very interesting feature now is called Snapshot. Snapshot will give you a previous visit date, and then you'll be able to see whether or not that person was on any medication. So this person didn't have any home medications on file for that last visit, but for today's visit, they do. So you can print a table from here if you're interested, or you can go back. Within this workflow, the Reconcile Meds workflow, you can take a look at the medication list. And if you're okay with anything that's listed on here, this is where you would go into the Action tab and just say that you reviewed it. So here's their patient's med list. I've reviewed all those meds, and then you can hit Save. Once you've done that, you're going to file and exit. And that queues up all of your medications, your patient's home medications, so that when you do put in orders, you are able to go right to continue from ambulatory and feel confident that these are the medications, the most recent medications listed for that patient. In this workflow, you can't tell when this list was populated, so there's no dates or anything associated with it. So the only way for you to be sure that this is the most recent medication list is to go into the Reconcile Meds tab and check the last time that this was updated. So you can see now my doctor, Dr. ZZ Orrs, is the last one that reviewed this med list. So it's just a good way for you to establish what the current medication list is. Another helpful feature is the external med history button. This button will help you identify any medications that the patient has purchased on the outside using their insurance. So if they've not given you a complete medication history, or you can't obtain one for whatever reason, perhaps the patient is obtunded or the family hasn't arrived, this is a very quick way to just kind of see what's out there as far as their medication list at other pharmacies that they've utilized to purchase their medications. This unfortunately does not cover anything that was given to them as samples or anything they paid out of pocket for, but it does give you a good idea of what medications they've purchased via their insurance. When you click the Med History button, anything that they purchased would populate here. So if, during the interim they were discharged last from the hospital, their provider put them on Coumadin, you would be able to obtain that information from the Med History. So that's a helpful feature of the external Med History. Again, using the Reconcile Meds workflow is a very safe way to obtain the most accurate, most recent medication list for your patient. Another helpful feature of this page is the listing of the patient's preferred pharmacy, so that when you come to the discharge portion of their hospital journey, it makes it that much easier to know that they do prefer e-prescribing as opposed to having written prescriptions. So if they have a preferred pharmacy listed, please do utilize that feature. If you need any assistance or have further questions, please don't hesitate to contact us via the helpline.